Cardiac imaging, comparison and assessment of imaging modalities. Cardiac imaging is visualizing the structure of the heart and cardiac blood flow for diagnostic evaluation or to guide cardiac procedures. There are many different modalities, but in this presentation we will be comparing computed tomography with magnetic resonance imaging. In recent years, due to technical advances and improvements, cardiac CT and cardiac MRI have provoked increasing interest in the potential clinical role in the non-invasive workup of patients with suspected heart diseases and also in correct patient selection for these emerging imaging techniques. Why is cardiac imaging important? Cardiac imaging is vital for the diagnosis and prognostic assessment of patients with suspected or known cardiac disease. The information collected during a CT or MRI scan can be used to identify the coronary artery anatomy and, in some cases, heart function. It can be used for the diagnosis and assessment of coronary artery disease, heart attack damage, heart failure, congenital heart defects, etc. In computed tomography, X-rays pass through the body and are picked up by special detectors in the scanner. The detectors differentiate levels of intensity. Higher numbers of these detectors result in clearer final images. For this reason, CT is often referred to as multi-detector or multi-slice CT scanning. 3D images and images in various planes are computed for evaluation of the heart and coronary arteries. A CT scanner is a large X-ray machine with a tunnel in the center. During the scan, the patient lies on a table that passes slowly through the tunnel. The gantry rotates around the body as it passes through. The X-ray tube releases X-ray beams that are transmitted by the body and picked up by special detectors. The beam captures many views of the body from different angles, and the data is sent to computers, which are then translated to 3D images. For cardiac imaging, the scanner takes pictures in between heartbeats when the heart is still. Therefore, a high heart rate may give blurry images. If your heart rate is too high, a drug may be used to slow it down. Magnetic resonance imaging does not use ionizing radiation. Instead, it uses radio waves that utilizes and redirects the alignment in hydrogen atoms that are found naturally in your body in water molecules. It doesn't cause any chemical changes in the body. The red sphere is a proton. It spins and creates a magnetic charge. When a strong magnetic field is produced, the proton aligns with that field. A radio frequency pulse is then introduced, which disrupts the proton, forcing it to realign 90 degrees or 180 degrees to the magnetic field. The pulse is turned off, and the proton realigns with the magnetic field, releasing electromagnetic energy. The energy released varies according to the tissue type, with factors such as density, surface area, and concentration. The scanner captures this energy and creates an image based on this information. So the patient is placed on the retractable platform that moves to the center of the machine. The magnetic field is produced through the use of wire coils. Other coils are sometimes placed around the part of the body being imaged. The magnetic field runs down the center of the tube. The coils also produce and receive the radio wave signals used to detect the hydrogen energy. Resolution. X-rays are a type of ionizing radiation, therefore CT is a good tool for examining tissue composed of elements of a relatively higher atomic number than the tissues surrounding them, such as bone and calcifications in the body. CT may be enhanced by the use of contrast agents containing elements of a higher atomic number than the surrounding flesh, for example, iodine and barium. MRI uses non-ionizing radio frequency signals to acquire images. so it is best suited for non-calcified tissue. Contrast agents for MRI are those which have paramagnetic properties, for example, gadolinium. So, in the past, CT was limited to acquiring images in the axial plane only, but now both can acquire images in any plane and can generate multiple 2D cross-sections and 3D reconstructions. Radiation dose. MRI does not use ionized radiation, therefore no radiation is received from after the scan. CT does use ionized radiation, and the typical effective radiation dose is 2.1 millisieverts to 7 millisieverts, which is equivalent to 0.9 to 2.9 years worth of natural background radiation in the average person. So MRI is safer than CT with regard to radiation. So the cost of the scanners were taken from the US-based company Block Imaging International. For cardiac imaging, it would be best to get a 64-slice CT scanner. The installation would cost about $150,000 to $250,000 US. The site planning and applications training, plus the service agreements, will cost an extra amount. The MRI machines are more expensive and can cost between $225,000 to $400,000 US, and this depends on the model and the manufacturer. Some machines can actually be more than $400,000. This price includes equipment, delivery, and installation. There are additional costs, and these costs are way more expensive than the additional cost for the CT scanner. This is basically because there's more overhead needed to keep an MRI running, both in materials and labor. In Australia, some practices offer bulk billing and expenses can be rebated from Medicare. For a CT scan, it usually costs $50 to $300, which is cheap compared to MRI, which costs $100 to $500. Speed. Well, usually cardiac imaging takes 30 to 45 minutes using MRI. This is actually quite a long time to be stuck inside a very small machine, so it would be bad for people who are claustrophobic. CT is faster and simpler and usually takes 5 minutes. The actual scan time is usually less than 30 seconds. And this short time also means that the scan is less sensitive to patient movement than MRI. The risks regarding MRI. Well, the radio waves and energy during an MRI scan are attracted to metals, so metallic implants in the patients may have a rise in heat during the MRI scan. Because of this, the magnetic field then becomes unstable and unreliable, and it may also clash with the implants that emit energy, such as a pacemaker, as seen in the photo. This can cause the pacemaker to malfunction. Now, the heating can also raise body temperature, and it could affect an unborn child. So therefore, it is not used for female patients less than 3 months in pregnancy. With CT scans, there is an extremely small possibility of cancer. A CT scan of the chest with a radiation dose of 8 millisieverts gives 0.04% stochastic risk. At a low radiation dosage, the chances of cancer is almost non-existent. Tissue damage such as redness of skin, necrosis, temporary or permanent hair loss is very uncommon and only occurs due to high radiation dosage for long CT scanning sessions. There are, however, chances of excess ionized radiation exposure, so it is strongly recommended to not be used on pregnant women or with patients with abnormal kidneys. The contrast medium used in CT scans can also cause allergic reactions. To conclude, cardiac imaging is very important in a clinical point of view. In the past, being able to diagnose, examine, and treat patients safely and with accuracy was extremely difficult to achieve and incredibly invasive. MRI and CT, which are both non-invasive techniques, have improved over the years. However, they, along with other cardiac imaging modalities, are still being assessed in many aspects in order to improve and ensure the safety of patients.